Hi, it's Nick here. It's a MedTech World Malta 2025. Vlastimil Hrabal from KARDI AI, this amazing new app you're showing me. Let's let's get down straight to business.
Hello,
It's good to
hi.
have you here, MedTech World, uh, doing business. A business that it's in the seed funding stage. It's running. It's got approval in the EU. It's doing something that with regards to the business, saving time, saving money for the state, putting the ECGs in the hands of the user.
So it's all what you just said. It's a remote long-term ECG monitoring, and we are detecting the heart arrhythmias. If you don't detect heart arrhythmias in early stage, it leads to the stroke, heart failure, or early onset of dementia. So we are like a first prevention tool for the general public to know how the heart is working and what's going on with their heart. So
And talking about the general public, for me, to look at your site, it looks. Obviously, it's got that corporate feel for a B2B, but it's a B2C product. I guess at the end, it's something that people will be surprised to know that like 29% of the people that looks to be like an average
yeah,
from tens of thousands of days recorded of ECGs.
Actually, it's a huge number that because when you standardly go to the hospital and you have this 24-hour Holter ECG monitoring, the detection rate based on the clinical studies is around 5%. Because the arrhythmias are coming unpredictably and you don't know when it will come. So one day monitoring it is something, but it's not enough. So that's why we created this long-term monitoring that you have it at home as a patient or user. You can monitor anytime, anywhere, as long as you need. And currently our detection rate is like 29%. So means 29% of all the users we have, we detected some kind of arrhythmia, heart arrhythmia, which is a huge number. It's a 6 times higher number than you are detecting with the standard tools in the hospital.
Because
So
you're covering more time, more chance
exactly,
for this
exactly.
opportunity
Yeah.
or the negatives to show.
Yeah. So the users are wearing it like every second day for 3 hours. Different situations. We also recommend to have it overnight. The belt you can wear it. Even I'm now wearing it. You can shower with it. You can swim with it. You can do gym. It doesn't matter. So it doesn't impact your daily activities, and it can actually save your life. We saved more than 300 lives in Czech
And
Republic.
give you peace of mind.
Exactly. Yeah.
Cool. All I'm thinking of, I'm just thinking of all of those hours and weeks and months of time of healthcare service time that's been spent on the heart rate monitoring, how that can be removed and how that time can be applied towards other needs in the healthcare system. It's staggering what
And
you can do.
the biggest difference between the us and the other devices is that they are monitoring heart rate, as you mentioned. These wellness watches, rings. We really monitor we have the real ECG signal, so the doctors can take a decision based on our results, and that's why we also got the certification MDR2A, which is the certification for the medical device for the European Union, so we can actually sell it to the hospitals, doctors, and they can take decisions about the medication, next step, surgery, based on our results.
But it's an incredible time. To reach this level in your entrepreneurial endeavor, to be at the point where, I can look at the territory. Okay, let's take on my home turf. Yeah, Czech Republic. And now to expand. I guess the Baltics next, just each individual kind of a localization of products taking on. I think people take a lot of inspiration from that, but also the seed funding that's there because investors believed in you and believed in your product. That the money is there to make this expansion now a route to market.
Yeah. So we finalized our seed round or extension round in June of this year. So now we're preparing for the expansion. We last month opened 3 markets: Bulgaria, Romania, and Slovakia. We choose these markets because the percentage of death due to the cardiovascular issues on these markets, it's attacking 55 to 60%. So when you look at Bulgaria and Romania, on all deaths, 55 to 60% are because of the cardiovascular issues. So the issue is really big. That's why we choose them as the first countries for expansion. We're preparing expansion in the Europe, but as well we are preparing for India, Singapore as entry gates to Southeast Asia, and Saudi Arabia and United Arab Emirates. So that's that's for us for the next year. Yeah.
Yeah, only. So some people are going to buy a dog next year. But hey,
Yeah.
thanks for with us, KARDI AI. Thanks for representing.
Thank you.
Nicholas signing off from MedTech World.